Good morning, everybody. Can I thank the nearly 60,000 people that came forward to get tested in New South Wales in the last 24 hours. The testing numbers are holding up really well, and we're deeply grateful that people are coming forward to get tested. Can I especially implore people who are carrying out essential work outside their home to make sure they don't go to work if they have symptoms. Yesterday to 8 p.m, New South Wales had 24 cases of local community transmission. Half of those were cases that were exposed in the community. A number of those cases were people who were conducting work in the last few days, some with symptoms, and we can't continue to have that happen. Whilst around half of the cases were in isolation for all or part of their infectious period, the fact that half were in the community for at least a few days whilst infectious is a cause of concern, and that's what we'll be looking at in the next few days and beyond as a measure of our success. We can't afford to have people continue to have the virus going about their business. We cannot continue to allow that to happen, and we are seeing, even though we're seeing the venues that people are exposed at obviously less risk because we're all in lockdown, hospitality venues and the like are not posing a risk. But people going about their business, shopping and interacting with others is causing the virus to continue to circulate, and we can't have that happen. In too many examples, we're seeing workers who are leaving the house with symptoms or going to work with symptoms, and then inadvertently, as they're going about shopping or other activity, they're passing it on to others. So it's really important for us to stress that where you can, do your shopping online. Where you can, don't go to places where there's lots of other people, because the virus is still circulating in the community. And the purpose of the lockdown, if we want the lockdown to succeed, all of us have to minimise our movements. All of us have to minimise our interaction with others, as difficult as that is, to make sure that the lockdown is successful. We know how transmissible this variant of the virus is, and we need to respond accordingly. So can I please urge anybody who leaves the house, assume that you have the virus or that people you come into contact with have the virus, and act accordingly. This is so important for us moving forward. Dr. Chant will obviously go through all those cases and provide more details from a medical perspective, but I just want to urge everybody to take into account that even if you're going out doing essential things like essential work, or more frequently, if you're going out just to do your shopping of essential services or products, please note that the disease is still circulating, and we don't want it to circulate further in the community. The whole purpose of the lockdown is to stop community circulation, community transmission, and that won't happen unless people stop interacting with one another, especially if they have symptoms. Can I also say how pleased I am to announce today that the New South Wales Government, through New South Wales Health, and I want to thank the entire New South Wales Health, the Secretary and Deputy Secretary Pearce who are here today, for managing the New South Wales Government's contribution to support the federal government's vaccine rollout. I'm pleased to say, as you know, the new vaccination hub in the Hunter is underway and will be open to the public. The New South Wales Government will also be opening up a mass vaccination centre in the Illawarra in Wollongong, but also one in southwest Sydney in Macquarie Fields, which is really important to get to the southwest community. We'll also be having a major additional hub in the Sydney CBD. So in addition to the 100 sites, in addition to the mass vaccination hub we have in Homebush, which is proving to be a great success, there'll also be the one in the Hunter, in the Illawarra, in Wollongong, in Macquarie Fields, another one in Pitt Street, in addition to the 100 sites that are available across the state. We envisage that once these centres are up and running, that New South Wales Health will be able to administer up to 200,000 vaccines a week. At the moment, we're doing around 100, 110, which is a great achievement, but we know that we'll be able to get capacity up to 200,000 once these mass vaccination centres come online. I'm also pleased to say the New South Wales Government has been working with the Pharmacy Guild here in New South Wales. From 19th of July, there'll be 22 pharmacies that will be coming online, initially in our rural and regional communities where communities don't have access to any other GP or a New South Wales Government health site. In areas where there's limited rural and remote access, that's where we'll be starting the pilot with 22 pharmacies. We know the Pharmacy Guild in New South Wales is keen to do more. We know they all want to come online, and we're keen for them to do more as well. But from the 19th of July, which isn't that way away, 22 will be coming online, and we're having ongoing conversations with the Pharmacy Guild. New South Wales Health and the Pharmacy Guild are having conversations about how we can scale that up as soon as possible. But obviously we've got to discuss issues with them with consent and other things, but we're really keen to get them on board. And at least from the 19th of July, we get out of the starting blocks. 22 will be available in rural and regional communities, but we're hoping to scale that up very quickly. Because we know once those extra supplies arrive, the challenge will be to having all hands on deck. So we're doing our part through New South Wales Health, through our mass vaccination hubs, our 100 sites around the state, plus getting pharmacies online. And also, of course, we'll start having conversations with the business community about having on-site vaccinations available at workplaces as well. But of course, we're also hoping more GPs will come online and that GPs will be able to scale up as well. And the Commonwealth, we understand, is having those conversations. And I just want to, again, give a good shout out to our GPs and thank them for the work they're doing. We know how critical they are to the mass vaccination or the mass vaccination rollout in New South Wales, and we're really keen to support their efforts in getting more doses to them, but through the federal government, but also getting more of them online. So I'll now ask Dr. Chant to give her update. Then Deputy Commissioner Worboy will be giving us some important information around compliance, and then we'll be taking your questions. Thank you.
Thank you, Premier. So New South Wales recorded 24 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 17 of these new cases are linked to previously confirmed cases, with 11 of these linked cases being household contacts. 7 cases reported remain under investigation. We have had 59,941 tests which were reported to 8 p.m. last night. So again, a big call out to the community and those undertaking that testing. Again, I need to ask you to redouble your efforts and continue to come out. I'd also like to just clarify, just because you've had a negative test on one day, if you get symptoms subsequently, it is important that you retest. So that message, those tests only tell you your status at a particular point in time. So we do acknowledge the community and thank them for many people who have gone back when they've got subsequent symptoms to get tested, but that is going to be an important component of the response. We have 2 cases in intensive care. In relation to the 24 new locally acquired cases, 12 were in isolation throughout their infectious period and a further 9 were in isolation for part of their infectious period. However, this still means that we are seeing cases in the community infectious. Also, I'd ask the community not to delay getting a test. Don't wait to see if you've got a severe illness. Don't wait to see if your symptoms get worse. As soon as you get symptoms, go out and get a test. Again, this helps us find those chains of transmission as quickly as possible. So there were 2 of the new cases. There were no new cases linked to the Great Ocean Food Seafood Wholesaler. There were 2 new cases that were linked to West Hoxton Park. There were 1 new case linked to the Crossways. There were new cases linked to the Joe Bailey at Double Bay. So again, another message is it is incredibly important that people remain, if you've been designated as a close contact, you need to remain for the full 14 days. We generally see a number of cases get picked up early, but we also see a smaller proportion of cases, people becoming positive towards the end of that 14 days. So again, please, a big call out to all of those people in isolation. If I could just pause a moment and just explain the difference between it, because we are still getting some feedback that people are confused between stay at home, isolation, what it means if you're a close contact and a casual contact. So the stay-at-home measures which are applied to those in the lockdown areas, or if you've been a returned traveller who has spent time in a lockdown area in another state, is that you are permitted to leave home for the 4 essential reasons, roughly. One is outdoor exercise, the second is getting essential food and services, and the third is obviously medical care. For the general community, there are no requirements. If you're in those categories, you need to seek medical care. If you are a close contact, it is important that you understand you need to be in isolation. So, of course, you have to access urgent medical care. If you need health care, reach out. But we do ask that you contact your healthcare provider if at all possible, or certainly alert the ambulance when you ring them that you are a close contact. So close contacts are in a different form of isolation. They're required to isolate themselves from all others in the household. And casual contacts are those where we ask you to isolate until you've got a negative test. But even those casual contacts, if you get symptoms down the track, you need to get retested and again isolate for that period. In terms of the cases of note, yesterday we announced a student nurse who worked at Fairfield Hospital and Royal North Shore Hospital whilst infectious from the 24th to the 28th of June. Testing of her family and household contacts has identified further cases. We're undertaking further investigations to understand the direction of transmission. But one of her household contacts is positive, and then also a close close contact is also positive. Now that new healthcare worker also works at similar places to her. She works at Royal North Shore, Fairfield Hospitals and the Royal Ryde Rehabilitation Hospital. We also know that one of her other contacts works at an aged care facility in Summit Care in Baulkham Hills. But I was very pleased to be advised that around 135 out of the 149 residents at Summit Care were vaccinated, and they had concluded their Pfizer vaccination for over a month. So that's very pleasing when we do hear about that. In relation to the case, if we go now back to the student nurse that I talked about yesterday, extensive contact tracing has occurred around that nurse, and we have identified one healthcare worker who was present at the ward on the Sunday when she was close to completing her shift. That healthcare worker pleasingly had not worked whilst infectious. So that new healthcare worker that had a small crossover with this individual had been rapidly identified as a close contact and hence did not go into work yesterday and instead got tested. Those results came back, but it was pleasing that whilst in the infectious period, this person, healthcare worker, did not go to work. So again, this highlights a few key messages. We still need to maintain essential activities, and we just need people to be particularly vigilant. If you've got the mildest of symptoms, please do not go to work. Instead, get tested and isolate. Be very conscious about your movements, please, before you go out and about. Check that New South Wales Health website. In terms of further venues of concern, and this is the time when I take the opportunity to describe areas where we don't necessarily know that there's been transmission occurred, but we do know there's been infectious cases present there, and they're more difficult contact tracing venues. And so we just want to call out to everyone so there's strong awareness. So anyone who attended the Pacific Square Shopping Centre at Maroubra between June 23 and June 30, or the Auburn Central on June 28, please get tested even if you've got the most minor of symptoms and isolate until you receive a negative test. And if any symptoms occur, please get retested. We do know in those centres that there were, on a number of days in Pacific Square Shopping Centre and in the one day in Auburn Central, positive cases moving about that centre. Now remember, people will be wearing masks, but masks are just one line of defence. When you're out and about shopping, please make sure you maintain that social distancing. On the note of masks, we appreciate the community is wearing masks, and thank you so much. It is one line of defence. But please continue to check that your mask fits over your nose and mouth. We still are getting situations where the mask is not fitting adequately. So that does afford us the greatest protection when those masks cover the nose and mouth. We've also had queries about essential work and goods and services, and I think I've addressed this issue. Please, the principle at the moment is we want to stop any unnecessary interactions between people outside your household group. We understand that your household will be exposed if you happen to have COVID, but what we're trying to do is make sure that your interactions don't pose anyone else at risk of you spreading it. So even when you're moving about in those retail environments, purchasing essential food, groceries, please maintain your social distancing. Wear your mask over your nose and mouth at all times, and please do not go out and about if you've got the most minimal of symptoms. In terms of other cases, we can confirm that there's been transmission on the flight that was the VA524 from the Gold Coast to Sydney on Saturday the 26th of June. We confirm that 2 passengers have now tested positive on that flight. We understand that both were isolating, but this is just still being confirmed from the second passenger. What we know is both passengers had been tested fairly promptly and had a negative test, but we're just confirming with the second case that they had remained in isolation after testing negative on that test and had been advised they were a close contact. That's our understanding. So again, this highlights the importance of us being able to find people very quickly, get them tested, and then we can be confident if they're negative that they're not a risk to the community. And also the importance of maintaining that isolation when you've been asked to do so. Thank you.
Good morning. In the last 24 hours, 65 personal infringement notices were issued. One of those of concern was a hairdresser in Auburn, in the shopping area of Auburn. What police will be doing is matching our taskings to those areas and places of concern on the health website. But in particular today, I want to send a very clear message that we will double down our efforts in terms of visibility and compliance in southwestern Sydney, in particular around that Auburn, Bankstown area, in those shopping areas, the central business areas, and also back to the eastern suburbs as well. The message is quite clear that police continue to be visible in the community on public transport. We are stopping and propping many people, and again, it's just disappointing that infringements continue to be issued. Thank you.
So we got in the right to provide an explanation as to what happened with Minister Dominello. I know there was a statement, but if you could just provide an explanation, please.
So I think I indicated, sorry, I shall take my mask off, a bit muffled. Okay. So in relation to the Parliament House, there was a lot of concurrent activity occurring. So in terms of the venues that we had general interactions within Parliament House as a subset of interactions. We had a National Party Room meeting, we had Coalition Party Room meetings, we had the Legislative Assembly Chamber budget speech, the Legislative Assembly question time, we had ministerial office meetings and the National Party function that I referred to, as well as then visitors that had gone into the premises. So there was lots of communication occurring, and as you know, part of our major issue is to make sure everyone's aware. So there was communication that went to a large number of people related to the QR codes that checked in. So what had happened is one of our public health clinicians had identified with assistance the sort of map about which areas we were going to find as close contacts within the chamber. That was communicated, but subsequently, because there was concurrent activity going on, some of our close contact tracings and other team members were actually interviewing a number of cases in relation to those other exposure sites. So what's occurred, and I regret this this, but as I said, everyone was doing the best with their best intent in trying to manage this complex workplace environment. That originally he was advised that he was a close contact, but then had an interaction with another public health official who was really referencing the exposure, that it was casual in relation to the office encounter with Minister Marshall. So that led to some confusion and miscommunication, and I regret that. As soon as it's been alerted to, we contacted the Minister. We've advised that he's had a negative test, and I can confirm that he was at no time a risk to the community. And as I said, I've apologised for the miscommunication, but it was because of that, the fact that there were concurrent activity and a failure just to reconcile that obviously being a close contact trumps being a casual contact in the two venues. We have subsequently gone through a reconciliation process to make sure that no other people are impacted.
How many other people in the community, how many other close contacts?
Victor Dominello about him being reclassified as a casual contact after he had been identified as a close contact?
I haven't had any. I can indicate that I've received texts from a number of people, and in all of those cases, I referred them to the public health official that was leading it. This is not a. This needs to be clear. We are following the best available evidence we have at the time. I think I've described the complexity of the environment. I think you have a feeling for that, given the number and nature of the different interactions. And people were moving as quickly as possible to get that advice, which is consistent with what we do in other settings. I regret that there was a miscommunication and the communication could have been more efficiently done. We've identified the issue. We are now reconciling, and to date no one's raised an issue that there's been a misclassification of anyone else.
Sorry, it sounds like you just said that people have texted you. So can you confirm that MPs have texted you about their classification as close contacts?
Well, can I just say that because this was a very complex environment, and also there were issues around MPs wanting to safely isolate in their residences, I actually had a webinar video link with the MPs over the 2 days where they was probably in the vicinity of 30 or 40 just to be talking about the emerging issues for them. And so there would have been a number of MPs that raised issues from issues that maybe they wanted to clarify the advice, clarify a text message, and a range of issues. So that was very open to a large number of people, that contact, and I'd certainly indicated that I'd follow up a number of issues that those members of Parliament raised, including things like where testing needed to be, where that provide advice on testing clinics and other things for them.
Do close contacts usually get downgraded to casual contacts? How often has that happened before?
Close contacts often get downgraded to casual contacts. I think I gave the example yesterday. I think one of the exposure venues we've had was a gym. I'm using the gym as an example, not because I'm trying to. I think it just explains it to the community. So, for instance, if you've checked into a venue, we don't know when you've checked out. So it could be a restaurant. So what happens is our close contact tracers think about the setting and what would be a reasonable time frame. So, for instance, it's a bit clearer where a restaurant only opens for lunch at 12 o'clock. But obviously some venues that are open for longer, we might take a very precautionary approach because people may be in, say, for instance, a gym for 4 hours or 5 hours. We know the time that the infectious person came into the gym and also the restaurant. So what we would do is ring a large number of people and find out when they departed. Often it's very clear because if we've texted everyone from 7 o'clock in the morning till that might have been there for the full duration. We usually allow some time at the end, given people sometimes are not precise with the exit time. We capture a large number of people and we then ring everyone and say, by the way, when did you exit the gym? Okay, you're taken off. Even the same would apply to a restaurant where you've checked in at 7 o'clock and we've captured everyone from 7 to 10. We know the case left at only got there at 8. If you'd been really quick and gone in and out, you will subsequently been downgraded to casual.
And you able to further explain, sorry, just in your comments there, how you said, sorry, I'll just wait. In your comments, you said at no time was Victor Dominello, and it says in the statement, a risk to the community. I guess some people would then ask the question, why does he then have to return to isolation? Can you explain that?
So this is a really important point. A test at a certain point in time does not determine whether you are going to subsequently develop the infection. So I'm now announcing cases that are associated with events a long time, many days ago. What we usually see with this Delta strain, and we have, and it's consistent with what we see in other strains, is we're seeing, if we're going to get transmission in an event, we often pick it up early. We're getting people picked up within, say, 48 hours. Usually the first 5 days declares the hand, and we see the most bump of cases. But there will always be the risk that further down in that 14-day period, we get a smaller number of positive cases, because the full incubation period is 14 days. So if anyone is exposed to COVID, until they are cleared of that full 14 days, they are not out of the woods from becoming a case. And we've had cases that have tested positive, they've gone in. We had a case where someone had tested negative in the morning because they were advised to do so, but actually a few hours later thought they had some symptoms, went and got another test. The test from the morning was negative. The test later in that day showed very, very low viral infectivity, but we could detect the virus then. So it is really important that the community understands a single test does not mean that you're clear of the virus, and that's why we need that full 14 days. On average, we do see most cases occurring in that blip, but we do see some cases occurring as far as, day 13 and day 14.
So Victor Dominello could test positive tomorrow. Wouldn't that mean that he would have been a risk to everyone here yesterday?
No, because we know he's got a negative test, and so this is one of the important reasons for having a negative test. We know he was negative. He has no symptoms. If he had a negative test and he had symptoms, we take a more precautionary role and even get them retested. But Minister Dominello had no symptoms at all, tested negative. Our testing is quite reliable. If he had have had significant levels of virus, we would have detected it. Yep.
Dr. Chant, if I can ask just about the Summit Care, moving to that, is your understanding whether that worker was vaccinated or not? Do you have information on that?
I understand that the worker was not, but to be frank, the focus was actually making sure there was a swift and good response there. We'll obviously be looking at the issues of vaccination and status, but I was very pleased that so many of the residents had been vaccinated, and again, I implore the community to come forward for vaccination at this time. So reiterate the messages around AstraZeneca. Please come forward. If you have been vaccinated with AstraZeneca, now is not the time to delay getting your second dose. It is critical. We know that 2 doses of both vaccines give a lot of protection against severe COVID, particularly hospitalisation, including against the Delta strain. So having those 2 doses is essential.
Your Queensland counterpart has this morning vigorously defended the advice she gave yesterday on AstraZeneca. Do you believe her comments have had more harm than good for the vaccine program?
The advice I've given is very much consistent with the ATAGI advice. So ATAGI has considered that on a risk-benefit, AstraZeneca should be that Pfizer is preferred for people under the age of 60. Obviously, that risk-benefit is influenced by people's individual circumstances, and obviously it can also change in terms of different settings of risk when we have community transmission.
What about her comments, Dr. Chant?
I think it's inappropriate that I comment. I haven't even had the time to review those comments or discuss with my colleague. I just want to reiterate the advice I'm providing, which is please do not delay. If you've had one dose of AstraZeneca and your time for vaccination is coming up, please do not delay. Make sure you've locked in a booking and get it. In terms of, regardless of your age, the rate of disease after second dose of AstraZeneca, the issue about the thrombotic concerns is really remote. And I'd just like to say myself, the Premier and the Minister have all received our second dose, and so that gives me a level of reassurance. I would also like to remind people that just because you're vaccinated, don't consider you can't get the disease. Okay, what the purpose of vaccination is, we know it actually can moderate transmission, like reduce your level of infectiveness, but it doesn't mean that you can't get the disease. So again, if I'm saying, if you're an essential worker and you've got symptoms and go, oh, I couldn't possibly have COVID because I'm vaccinated, think again, get tested.
Sorry, just back to the Victor Dominello situation. Did he text you himself asking to be reclassified from a close contact to a casual contact?
Reclassified to a close contact.
So he was initially a close contact. Did he text you asking to be reclassified as a casual contact himself, directly to you via text message?
Look, I've had many encounters. I haven't it hasn't been a focus. I can just reassure the community that the public health officials, there is a formal risk assessment document that had to be developed about criterion we applied in all of those settings. The fundamental issue is that there were, I think, 7 or so settings where people could have fallen in different categories. And because we were concurrently assessing people, for him there was a miscommunication because the issue relates to the fact that the Adam Marshall identified a number of visits to rooms, individual ministers' rooms. A separate person was ringing people to assess the nature of that contact and triangulating that with other people's recollections, and that was the basis of that assessment. What should have happened was being very clear that the close contact trumped a casual contact and a failure to reconcile. There really isn't anything more to this. I've got to say that this venue, notwithstanding its complexity, was also a lower risk concern to us because of our understanding that the Minister did test very low levels of infectiousness the subsequent day on the Wednesday at 7:45, and we did have an expert panel that ruled that we couldn't exclude that from 7 a.m. on the Tuesday that he was actually infectious, but I have indicated that infectiousness was likely to increase over the day. All of those factors played into our decision making, but we took a very cautious and a conservative approach, as you would expect us to do, given the importance and mobility of that group of people.
Just to the student nurse, can you confirm the genomic sequencing around the student nurse is an exact match to the Bondi Delta strain?
Okay, I can't. I'll have to check. The genomics sequencing is really, really quick. And I really want to express my gratitude to the lab. I'm sure that will be in later today, but this specimen would have only been received at the lab yesterday, so I would expect later today to have an indication. We will obviously are sequencing every case associated with the cluster, and because when you're dealing with a cluster of this nature, we know that there are other strains in other states. And we do need to always keep an open mind. I just remind you to the fact that during the Avalon cluster, we did have the Berala cluster as well concurrently, so it is important that we do that genomic testing. We will announce any issues results that are important in terms of contact tracing or other public health response, and I'll update you tomorrow.
Just clarify with the healthcare workers. Premier, sorry.
Last question, please. Was she required to be vaccinated?
At the moment, there is not mandatory vaccination for all healthcare workers. Certainly, can I just say that we've had incredible access to the vaccine, and our hospitals have really prioritised getting vaccination to our health professionals. I think there's been over 200,000 vaccines administered to healthcare professionals, both across the private and public system. But my key message is, please take up any opportunity to get vaccinated, and please get your second dose of AstraZeneca as soon as possible.
Premier, when will you make a call, Premier? When will you make a call, Premier, on what happens to
can I just say...
Did you speak to Victor Dominello or text him asking if there's a potential for him to be reclassified in the first instance from a close contact to a casual? You had no contact at all with Victor Dominello?
No. Well, obviously, he was at a press conference with me yesterday. These are matters for our health experts. And can I make this point very clear? We are in the middle of a pandemic, and my priority and the priority of my government is 8 million citizens. That will be the focus. And I just ask everybody watching and listening today to please follow Dr. Chant's health advice. Please follow the advice the government is providing. If we all work together, we will be okay. But we need everybody to please follow the health advice and focus on what matters to us in coming together to get through this. Thank you.